Okay, let's dive into this step one question. It's super good. So 28-year-old woman, emergency department, she's got fever, all this stuff, including dizziness and all that stuff. But look at that fever. She's confused, disoriented, blood pressure. She's in shock, heart rate 125. She's got diffuse erythematous rash that's like sunburny. And sometimes I might also say that she has like, just a huge rash. And they might also mention, tampon use, because it absorbs the menstrual blood and introduces oxygen into the vaginal canal, which can have a good aerobic environment for Staph aureus. But in this particular question, they're asking us, which immune mechanisms is responsible for this patient's condition? So take a sec, look at those. All right, so we'll dive right in. And just before we do this, I just want to explain a little bit about what's happening here. So toxic shock syndrome, that's what's going on. And so the correct answer is going to be a non-specific widespread activation of T cells and macrophages. So gut fever, hypotension, diffuse rash, and multi-organ involvement. The creatinine is elevated, liver enzymes are elevated, toxic shock. And toxic shock is caused by, for step 1, you know, Staph aureus. And the retained tampon, that's suspicious for a menstrual toxic shock syndrome, pretty common. And it's a superantigen, TSST1. It's a superantigen that's produced by various strains of Staph A. And so superantigens bypass the normal presentation system by doing a couple things. They bind to the MHC class II molecule on antigen-presenting cells, like macrophages and dendritic cells. And they also bind to the T cell receptors on variable beta regions, activating up to 20 to 30% of all of the T cells at once, usually 0.01%. So there's a massive release of cytokines. And so IL-2 from the T cells will cause a fever and T cell proliferation, hot T-bone steak. And IL-1, interleukin-1, and TNF-alpha for macrophages causes the capillary leakage and hypotension and shock. And then TNF-alpha and interferon gamma will cause inflammation and multi-organ failure. And so why the sudden fever? Well, that's IL-1 and then TNF-alpha. Hypotension, tachycardia, septic shock. It's because TNF-alpha and IL-1 will cause also that capillary leakage, vasodilation, compensatory tachycardia. The heart rate is trying to maintain perfusion. Why that rash that looks like a sunburn? Widespread capillary damage and cytokine release affect the skin, microvasculature, and later on you have like desquamation of the palms and the soles. The GI vomiting and stuff. The cytokine releases of 1, 6, and TNF-alpha will cause nausea, vomiting, and diarrhea. Multi-organ stuff, renal failure, increased creatinine. That's due to the hypoperfusion from the capillary leakage and the hypotension. How can you perfuse if you don't have the blood? Liver dysfunction, so increased AST and ALT. TNF-alpha and IL-6 will mediate inflammatory hepatotoxicity. Neurological stuff would just be due to, hypotension, poor cerebral perfusion. Other choices, let's talk about them. Cross-linking mast cells, that's histamine anaphylaxis. Not going to be related. Non-specific widespread activation of T cells and macrophages. That'd be seen in parasitic infections and allergies, like asthma and hypersensitivities, but not toxic shock. So direct cytotoxicity of bacterial toxins to endothelial cells, that'd be Clostridium perfringens alpha toxins. And Clostridium perfringens alpha toxins, or maybe also Pseudomonas exotoxin A, and that can disrupt these membranes. And it's not a cytotoxic process, it's just an excessive immune activation. Direct cytotoxicity and bacterial toxins to endothelial cells, that would be it. Activation, antibody-mediated complement activation. So if it's antibody-mediated, that'd be relevant in immune conditions like lupus or post-streptococcal glomerulonephritis. And this is toxic shock is driven by T cell and macrophage activation, not the antibodies. That'd be more like your lupus. So there we go. Toxic shock syndrome, fever, hypotension, big old rash, GI, renal involvement, liver, other problems, liver problems in the in the labs. Decreased platelets could be present. You give them IV fluids for the hypotension anytime you got shock, and give them clindamycin to stop the toxins, and vancomycin to cover for MRSA, and just take out the tampon or wound dressing, whatever it might be. And so that's toxic shock syndrome, Staph aureus, TSS2, causing activated large numbers of T cells and high fevers, hypotension, diffuse sunburn rash, multi-organ failure, T cell, IL-2, macrophage activity, IL-1, TNF alpha, fever, leakage, all that stuff, just classic T cell activating pathways. So hopefully that's helpful. If it was, like and subscribe.